Hello, I'm Robert L. Barkin, a practicing doctor of pharmacy and educator in the Chicago, Illinois area. I've been engaged in pain management since the late 1970s. As pharmacists, we play an integral role in pain management by assisting both patients and the prescribers, when needed, with the selection of over-the-counter analgesic agents. There are important considerations we need to keep in mind when assisting in the selection of these products. We should remember that we may be the last healthcare provider a patient sees before utilizing an over-the-counter product. It is important to know what questions we should be asking patients to help ensure that we make an informed recommendation. Let's talk about how pharmacists can support patients in selecting a safe and appropriate over-the-counter analgesic medication. 3 key considerations we should keep in mind are to assess each patient's medical and surgical history to identify an appropriate product, explain the rationale behind the recommendation, and ensure that the patient understands that the choice of product is individualized for them. In the pharmacy, patients are faced with a wide variety of over-the-counter options for pain management. When patients ask us questions on pain management, we must take the opportunity to help them find an appropriate over-the-counter analgesic medication based on their individual needs, their medical and surgical history, and their age. Each patient is unique and requires personalized considerations and recommendations. Before recommending a medication, we should review key patient characteristics such as age, gender, medical and surgical and laboratory history. If an NSAID is being considered, it is important to know if the patient has any medical conditions that may be exacerbated by NSAID use, such as cardiovascular disease, gastrointestinal bleeding, kidney disease, or hepatic conditions such as liver cirrhosis. The patient's social history is also important. For example, women who are pregnant or breastfeeding may require special considerations. If acetaminophen is being considered, it is important to assess the patient's social history and the potential presence of liver disease. We also need to identify any medications the patient is currently taking or has previously taken so that we can evaluate the potential for drug interactions. Asking the patient about current and previous medications gives us the opportunity to intervene if multiple pharmacotherapeutics within the same class or interacting drugs are being taken. For example, if the patient is currently taking low-dose aspirin for cardioprotection, its benefits may be attenuated by ibuprofen. It is important to ask the patient to list all medications, including over-the-counter products, herbals, supplements, and other medications stored at home. Remember that patients may be familiar with a brand name of medication, but not the active ingredient. When we ask patients if they use an NSAID, they may say, "Yes, I use Tylenol." What is an NSAID? No, I use Motrin. These discussions give us the opportunity to serve as a resource and educate patients on the classes of the over-the-counter analgesic medications. Because patients may not be familiar with the class of drug associated with a specific brand, it is beneficial to refer to the drug by both its trade name and its generic name. Once we review each patient's medical and surgical history and their medications, we have the opportunity to explain how this information impacts the choice of over-the-counter analgesic medication. When communicating with patients, we must provide specific details on why a particular choice was made and how it was personalized for them. Remember, patients may have other over-the-counter analgesic medications at home. Be sure that they understand whether these products are appropriate for them. We should also review the dosing of any recommended over-the-counter analgesic medication with the patients to help ensure that they will use the product appropriately. Patients understand and remember the specifics of our conversation better when we use terms that they are familiar with. When specifying a dosing schedule, it may be more effective to do so in terms of time. For example, 6 a.m., 2 p.m., and 10 p.m., rather than a frequency such as 3 times daily. By specifying particular times, we can help minimize the chances that patients will use the medication too soon or too frequently. While achieving relief from pain might be the highest priority for patients, we know that understanding their medical, surgical, laboratory, and social history, as well as current and previous medications, is critical when making an appropriate over-the-counter analgesic recommendation. It is also important to discuss expectations for pain relief with patients. We can remind patients that a pain-free state may only be achieved with anesthesia, but analgesia with over-the-counter and some prescription medications can decrease the duration and intensity of pain. We have a world of generic drugs, but no generic patients. Every patient requires specific considerations and an individualized recommendation. Once we have made a medication recommendation, we can help patients understand why the decision was made and how the choice of product was specifically tailored to their health history. By focusing on the considerations we discussed today, we can be confident that patients are leaving the pharmacy with more knowledge and awareness and are taking an over-the-counter analgesic medication that is appropriate for them.